Now, may I invite, for the highlight of today's event, may I now invite Tony Singanaya to briefly take us through about the benefits that an applicant may gain by applying to the Commonwealth Digital Health Awards, as well as about the recipe of success. Tony, over to you.
Thank you. Thanks, Pandula. First of all, a big thank you to everyone for joining the webinar today. It's really nice to have this many participants. I'd like to start also by thanking my colleagues, Professor Vajira, who has been, obviously without him, none of this would happen. He founded the whole Commonwealth Digital Health Awards, remains chairman of the Commonwealth Center for Digital Health. Sachindra, who it's a great privilege to work with Sachindra. I know how much he does and how much passion he has for the ecosystem in Sri Lanka. So I'm privileged to be on a panel with him. And of course, my friend and colleague, Dr. Pandula, who has all kinds of qualifications, including PhDs and things that I definitely don't have. But he's very humble about it. So he says, I'm Pandula to start, but he's got like 16 qualifications behind his name. So I have 3 jobs to do today. One is to tell you what applicants get, and the emphasis is on the word applicant, not just winners, because in many contests, the winners get a lot, but the applicants don't get anything, people who don't win. And this is different. The second thing I need to talk about is who are the judges, and the fact that these judges alone are people with great influence. And this influence actually wraps around each of you. If you decide to apply, they pay attention to just applicants alone. And I want to talk about that. And then, of course, the all-important sort of the cheat sheet of how can you win. Because this is, when we were small, our teachers used to say, now pay attention because this is going to be on the test. That's what the last point is, how you win. This is going to be on the test. Okay, so Pandula, next slide, please. Right, so this is what applicants get access to. And again, emphasis on the word applicant, okay? So the first thing we get is we have investors and acquirers. So for example, I worked at Johnson & Johnson for 20 years, and I had responsibility for an area for 10 years called new category development globally. And what we know is which multinationals are actively acquiring innovations in the areas that you are focused in, right? So whatever you're focused in, we know which multinationals are likely to be most interested in what you're doing. And this is for applicants, right? We provide access to applicants, to the multinationals. And when we get to the judges, you see exactly why I'm saying this. The other thing we do is that Professor Vajira mentioned the Princeton Frugal Innovation Accelerator. This is a new group that we've formed. And there are individuals with money, serious money, who are looking to invest in innovations coming from countries like Sri Lanka and other emerging markets. Just to give you the name of one of them, is Don Hoffman. He used to be the head of investments for JP Morgan globally for the industrial and consumer sectors, right? So people with serious money and the ability to invest and the interest to invest in startups like yours. So that's the first thing applicants get access to, investors and potential acquirers. The second thing is also something that's extraordinarily difficult. I grew up in Sri Lanka, and it's very difficult sometimes to get broad access to international customers without wasting your time. You can talk to 100 customers and finally only one ends up buying what you have. We have access to, through the Commonwealth, we have access to many international customers. It does take some work to connect you with the customers who want what you have, but we have the mechanisms to do it. And the way we do it is that the Commonwealth is an organization of 54 member countries that have 2.4 billion people living in them. Through professors' contacts, we have direct contacts with health ministries in those organizations. Again, you'll see some of the judges when we get to them from health ministries. NGOs, the Gates Foundation, the WHO, these are people you get access to through the awards process. And the third is experts. one of the things that frustrates me, to be honest, is that Sri Lanka has so many wonderful experts. But sometimes if you're working with an international company, they also need to see an international expert working alongside the local experts. So what we can provide is, in addition to the wealth of technical competence, real technical competence that Sri Lanka has, we can provide you access to hundreds of technical experts who could be critical to your success. And this includes the fact that in the 54 member countries in the Commonwealth, there are over 500 universities. Over 500 universities. Obviously, there are experts in those universities. And then, unlike other institutions that just have sort of an award ceremony and don't provide hands-on guidance, we provide we're really passionate about what we're talking about here. So we provide hands-on guidance to you, saying, these are the little dials that you have to improve from your business model. What's the clinical need? You know, we provide hands-on advice, not just generic one-size-fits-all advice. We come in, if you want us to, we come in and really help, try to help, give you advice on the questions that you might have. Next slide, please, Pandula. So my second topic is judges with influence. And this is one of the huge advantages that we bring you, again, through Prof. Vajira and others. I'll just highlight a few people. I mean, you can read, obviously, but I can highlight a few people. So the lady on the top right, next to Pandula, is the Senior Deputy Director Planning in the Ministry of Health, Malaysia. So these are the kinds of people who know exactly what Malaysia is looking for, what NGOs are funding through the Ministry of Health in Malaysia, right? Prof. Vajira has a number of contacts in the health ministries. My friend Ali Farsi, who is Director of Pain Relief for the entire category of pain relief in GSK in the US. He's based in the US, but he's got worldwide responsibility. Professor Yousef Yazdi, who's head of bioengineering, biomedical innovation at Johns Hopkins University. I've known him for 30 years. Ben Wiegand, a senior vice president at United Health Group, which is the largest health insurer in the US. Their revenues annually are $350 billion. He's head of research and development there, knows exactly what they're looking for, obviously. I'm going to skip over a few people, but there's Arjun, who is, sorry, Pandula, just one more on the last page. Arjun, who is Program Officer for Digital Health at the Gates Foundation in India. Next, please, Pandula. And just to touch on a few other people. So Anup Singh, who Prof. Vajira mentioned previously, he's on the board of the Commonwealth Center for Digital Health. He's also responsible for STEM education, on a committee for STEM education through the Commonwealth. Sinclair used to be chief scientist at British Telecom. So obviously a person with interest, influence, and insight into that industry, the whole telecom industry. I'm going to try to go a little bit faster. Barry Rebner, who is chairman of the Princeton Frugal Innovation Accelerator. He was president and CEO of a hospital in the Penn Medicine System in Princeton, called Princeton Health, for 20 years. So he understands what hospitals look for, what precisely they look for in an innovation that you might be developing that may be required. You might need to sell it through a hospital, and he knows exactly how hospitals make selections. Bastian, who is the WHO, in the WHO focus group on artificial intelligence for health. Guru, who used to be worldwide head of medical devices for Amazon Web Services. He's now moved on from that position to another very senior position in a medtech company in Amsterdam. Next, please, Pandula. Kelly, who is a venture capitalist, and he's managing director of a venture capital fund called Spindletop Capital. Hani, who is at the ITU. The ITU was established in 1865. It's a UN agency. It is the oldest UN agency in the world, established in 1865. and it controls and regulates global regulation for telecom. So he's extremely influential. If anybody is sending data, from a device to from a person to a device to a cloud, what privacy laws have to apply, what technology works, what's on the roadmap for future technologies. He has access to all that information. Is there another page also, Pandula? All right, okay. So we've got, people from Adam, who's at the Smart Health Leadership Center in NUS, Singapore. Ashley McKim, who is editor-in-chief of the British Medical Journal, which is the oldest peer-reviewed medical journal in the world. Steve Pitt at the bottom, head of New York, Boston, and Philadelphia for Johnson & Johnson's incubator. Janet Nikolovsky, who's a PhD biochemist working deep inside Johnson & Johnson's R&D, and so on and so forth. This was last year's panel. I hope to see many of these people on the panel this year as well. But I just want you to feel confident that the judges that you will meet in the application process, in the judging process, are not casual observers. They're not just here to do a job and, assign marks to you and assign marks to me. They really are interested in what you're doing. And if you get their interest, you can be assured that they are going to be willing to help with advice, perhaps, with real insight into, look, do this, don't do that, so that you don't waste your time. Right, Pandula, next and perhaps most important, how you win the checklist. Next page, please. So we have, I think, about 7 different factors, and I'd like to go through each of these. So what you're looking at is the first 2 questions that we ask in the application process. So Pandula mentioned that it's not just health, but what the WHO is calling the social determinants underpinning good health. Income, nutrition, does the person have the education to look after themselves, and environmental issues. The question is, how does your innovation improve one of these things? What earns a high score? You have to solve a serious problem that's causing pain and suffering to a lot of people. The bigger the problem, the more serious the problem, the more people affected worldwide, the higher the mark, and you get 20 points maximum for that. The second question is, okay, so you have an innovation. How do you know that it actually works? Do you have evidence that it delivers great results? The highest score you get from actually using the data with target consumers. That is, there's a sufferer, there's a person who needs this, we've used it, we've sold it, or even in a test case, the person has used it, and we've got confirming evidence that it actually delivers the result we promised that it will deliver. The next best score comes from a well-designed trial. So this is not real world, it's a controlled environment, but you've got data from a trial, even with 2 people, 100 people, whatever the number is, it's a controlled trial that says, yes, what we do works the way it's supposed to work. And the last is, the minimum that you need here is a working prototype. So you haven't tested it anywhere, but in the lab, you have demonstrated that it works. So the 3 standards, the minimum, it works in the lab. The next best, it works in a controlled trial. And the best of all is it works out there in the market. Next page, please, Pandula. Right, thanks. So on this one are questions 3, 4, and 5, and this all relates to differentiation and innovation. So the first question is, are you doing something new and different, right? What is new about what you're doing? Is it the technology, the science, or the technology and science is old, but the way we put the design together is wonderful? Or the first 3 are old, and it's really the way we've designed the user experience that's really new. So for example, if you take Uber, they didn't do anything new to taxis, but it was really the design of the user experience that changed dramatically, right? So any one of these things, how new is it? How innovative is what you're doing there? Obviously, if you can check more than one of these points, it's better. The fourth question is, how different do you look than your competitors? You know, the thing here is, even if you are doing something really different in question 3, if the consumer looks at it or the sufferer looks at it and thinks, I don't get the difference, it looks exactly like what everybody else is doing, you've got a problem in marketing. So if you look different, that's even better than actually being different, right? So what do I mean by that? As you know, there are a lot of companies out there, a lot of brands out there with products that are not really differentiated, right? Think about soap or shampoo or any of the 20,000 different consumer products that you and I buy to live our daily lives. Very few of them are genuinely different, but the branding lets them look different. So this fourth question is asking, is there an opportunity for branding to differentiate what you're doing in column 3? How easy or hard is it? The fifth question is, do you actually get better results than your competition, right? Now, this can be borne out by evidence or a claim that you will get the evidence. So don't be intimidated by that last question, number 5. The superiority can be demonstrated in a number of ways. Branding, it can be demonstrated in question 3 or question 4. We can help you with that, right? And if you have a game changer is an answer to 3, 4, or 5, that would be wonderful. This is a heavy weight. It's 30 points, and this is differentiation. Next page, please, Pandula. So the last 2 questions, the 6th and 7th questions, these are really important to us because, you know, we come from countries like Sri Lanka. If you look at the 54 member countries in the Commonwealth, a good 70% of them are poor countries. I mean, no other way to say it. There are a lot of people who are poor countries. And the Commonwealth Center for Digital Health and the Princeton Frugal Innovation Accelerator are really keen to make sure that the solutions are very affordable, even for people who are not wealthy. You know, we've got enough products and services that only rich people can afford. We need to come up with ways that help people who don't have a lot of money. And that's a key focus area for us. So what earns a high score? It's very affordable to buy, use, and maintain. Not just the price, but also maintenance is easy and affordable. You know, you don't need 3 PhDs to use it properly. So basically, if your solution does not need advanced infrastructure, complex customer training, or complicated after-sales service, that's what earns a high mark here. Again, 30 points. So it's pretty important. And the last one is because we're the Commonwealth Center for Digital Health, and because digital technology, machine learning, and AI have the power to dramatically increase the value of a solution and reduce the cost to deliver it, right? 2 key drivers there. We're very keen to make sure that your solution includes some digital technology and data analytics. You know, what doesn't really matter whether you have a great algorithm or not. The question is, does the data that the algorithm produces provide insights? Does it reveal hidden information that a consumer or professional will not know if they didn't have your solution, right? The second thing is, it's great to have insights. I mean, wonderful to have information, but can you actually drive positive behavior change? Will it make me change my behavior? If I'm not exercising, will your solution and the insight give me that little nudge, that little push to make me walk a little extra or do something new? So those are the 7 factors, and we pull them together in the last slide. On to the next slide, please. Right. So this is the scorecard. Right? This is what will give you 2 things. One is, if you score well, it'll help you win an award. And we give out about 25 to 30 awards every year. Obviously, that's important. But if you apply, even if you don't win, what it gives you is sort of this, we help you lower the microscope on each of these 7 things which is what investors also want to know. We help you refine, distill, polish your presentation so that it fits and so that the investor looking at it through their 7 lenses looks at you and recognizes the wonderful stuff that you guys are working on. So that's it. Almost out of time. Maybe we have time for a couple of questions, but hopefully that was helpful. Pandula, back to you.
Yes. Thank you very much, Tony, for that insights. I mean, you explained it very well because there's so much of complexity in so many award schemes we have seen. But what we are actually looking for, this is not really, for me, it is not really only a scorecard, right? It also allows us to identify the needs of the potential applicants, as well as support them in areas where they really need. And that's why probably I think you said that this is not about only winning, but this is about applying for it. Tony, you have any comments on that?
Yeah, I mean, the value, so, okay, so a couple of things just to build on what Pandula said. Our application process is really simple, right? I mean, it's not going to take you a week of time to figure out, how do I get the data and this and that. Our application process is very simple. So if I were to weigh our application process with sometimes this massive paper almost that you have to write to get into other award processes, ours is trivial. It's really easy to apply. When I compare the low amount of effort to apply with the potential value that comes from getting your application reviewed, that's a big jump. If I compare that with the value of actually winning, we've got companies in the previous, now we've done this is the 5th year, so we probably have got, I don't know, maybe 2,000, 2,500 applications over the last 5 years. What the applicants tell us, not just the winners, is that when you get noticed and win an award in the Commonwealth awards system, investors suddenly start paying attention to you because they make the assumption that, okay, for these guys to have won an award or at least come into the short list, they must be doing something special. So investors pay attention, companies pay attention, and it's a confidence booster for you to actually initiate conversations, because you saw the charts Sachindra showed you. There's thousands of startups in the world out there. We help you stand out. So if you look at just digital health investment alone, in 2013, worldwide, there was $2.1 billion invested in digital health startups, the kind of stuff we're looking for. By 2020, that number had gone up to $20 billion. And it's increasing now, especially after COVID, right? That kind of growth, what's happening is the number of people piling into this, trying to get some attention, is just massive. We help you get attention. We give you a stage to stand on so that investors and corporate buyers will pay attention to you. Pandula, I hope that was helpful.
Yes, definitely, Tony. I mean, that elaborates. And also something that I would like to emphasize, Tony, is that under different categories of education, fintech, and so on, there are some variations in terms of the judgings also to fit each of these categories, so that they are not really taken out of context of the innovations and the products that are coming through. I'm sensitive to the time, so may I ask one last question from Sachindra? It's not a question actually, but a comment from your end. How would you advise the Sri Lankan startups, innovators to engage with the awards process? What should they do in terms of preparation? Do you have any advice, anything for them to use?
Sure, Dr. Pandula. So in terms of the process, this is quite, I would say, this is a This is like the lean canvas model that we map each startup product to. This gives a very nice approach of and a very simplified approach, as Tony was mentioning. And listening to what he was saying, even going through the application process and getting that feedback. And I really hope and I can request if the judges can provide that feedback in some form, that will be very helpful. And hence why we ask, even for spiralation, we get about 163 applications, which about 64 gets to pitch. What we realized in Sri Lanka also is that time that you get to present or get your application reviewed is crucial, and especially reviewed by the experts that you mentioned, people who are in the game, who are experts in the game, and who know how to direct a startup, either to tell them you need to pivot or you need to grow. That's a very, very important feedback a startup could get at the stage that they are in, especially at the MVP, so that they won't waste more time going on the wrong path, especially in this field of health science. And secondly, we definitely encourage startups to, since the Commonwealth Health Awards is connected to the Princeton Frugal Innovation Accelerator, because the path is there, that is the path a startup can take to become a unicorn. A lot of people are talking about wanting a unicorn in Sri Lanka. So many people talk about it, but without this path created, I don't think we can even create a pony. So it's market access to larger markets, just like Tony was saying. How many people are you impacting? Are you impacting a million or a billion people? It's that impact which has created the unicorns, the bigger markets which are there, the problems which are being addressed for larger markets, which have brought in that valuation of $1 billion, which brings in that investment. So I'm confident, and I would encourage startups to give it a try, because it's not a long time, as Tony was mentioning, to fill the application form. Just filling it will also help the startup fine-tune the solution that they would have. And even certain early stage startups are also encouraged. If you do have an MVP, that will be better. If you have gone into the market with traction, that will be even better. But I think you're open to various stages of the startup life cycle, as you mentioned as well. So giving it a go, I think would really, especially because of the feedback retained, would be really crucial for startups who are pursuing this space. Thank you, Bart.
Thank you very much, Sachindra. That was nicely rounded off from your end. And Tony, do you have any?
I know we're just 2 minutes over. Just one quick thing. You know what Sachindra was just talking about? Sachindra has kindly introduced me to a few of the startups that 𝐸CTA has helped bring together. And one of the things that I have noticed is how many of those, because of 𝐸CTA connections, now have access to international customers. I mean, there are startups that are earning $400,000 or $500,000 a year easily. And a lot of that has come because of international connections that 𝐸CTA alone has brought. I mean, I'm actually pleasantly surprised. I shouldn't be surprised, but I'm pleasantly surprised that how much 𝐸CTA has between the government support, powerful business people, support in the country, their advice, the amazing efforts of people like Sachindra and his colleagues. So, you know, this 𝐸CTA ecosystem is, as Sachindra mentioned earlier, this is something that Sri Lanka can actually have a distinctive difference in, right? This is where you can help Sri Lanka make a difference. So I know, you know, it's wonderful to think that we have to win as a startup, but just think that you're doing something bigger than just making your startup succeed. It's a country's national priority, I think. That's what we all have to focus on. Right, Pandula, we're over time, so sorry about that, but thank you very much for organizing it. And again, many thanks to everybody for joining us today.
Thank you very much, Tony, and thank you very much, Sachindra, Professor Vajira, and other participants for taking part. Please do apply if you are an entrepreneur, if you have innovative, if you have an idea, do go to the awards.cwcdh.org. The deadline is on 15th April. Before that, you submit your applications and be sure that you will be you will be surprised how much of an unlocking that you can do with new frontiers in digital health as well as in other fields that we have opened. So with that, we will close this session. Thank you very much for taking part, and see you with a similar session. And please do keep, please do be updated on the new developments related to the Commonwealth Awards as well as the Commonwealth Center for Digital Health. Thank you very much for taking part.